Welcome to Family Lifestyles. I'm Lynn Blankenship, the Extension Agent for Family and Consumer Sciences Education in Metcalfe County, Kentucky. And today, I would like to talk about radon. Radon is a naturally occurring radioactive soil gas that is colorless, odorless, and tasteless. And through decay, it breaks down into hazardous particles which can be inhaled. Radon levels are measured by units of radioactivity per volume of air called picocuries per liter. And we're talking about radon today because our area in Kentucky is an area where there is radon prevalence. Radon is found outside and indoors. Outdoor levels are typically below the EPA's recommended action level, and higher concentrations of radon can be found in homes, schools, and office buildings, entering through cracks in the basement or foundation. And because we have caves in our areas with limestone karst topography like we have in South Central Kentucky, are more prone to people finding radon prevalence in their homes. We are going to be joined by two guests from the University of Kentucky to learn a lot more about radon and how it can impact our environment. Stacy Stanifer, PhD, APRN, AOCNS, is an advanced practiced registered nurse, oncology clinical nurse specialist, and assistant professor at the University of Kentucky College of Nursing. Dr. Stanifer is a member of the University of Kentucky College of Nursing BREATHE team, the Cancer Prevention and Control Research Program, and Lung Cancer Translational Research Group at the Markey Cancer Center, and an associate member of the UK CARES, which is the Center for Appalachian Research and Environmental Sciences. Dr. Stanifer's research interests concentrate on reducing exposure to two environmental carcinogens, radon and secondhand smoke, as a means of cancer prevention. In addition, Dr. Stanifer has an interest in using research to inform health policy. BREATHE stands for Bridging Research Efforts and Advocacy Towards Healthy Environments, is a multidisciplinary research, outreach, and practice collaborative of the University of Kentucky College of Nursing with partners internal and external to UK. BREATHE's vision is that all people will have access to clean air and live in healthy environments. BREATHE's mission is to promote lung health and healthy environments with at-risk populations to achieve health equity through research, community outreach and empowerment, advocacy and policy development, and access to health services. BREATHE, formerly known as the Clean Indoor Air Partnership, was recognized as one of UK's Commonwealth collaboratives, and it received the Exemplary Project Award for Community Engagement in 2011 from the Association of Public Land-Grant Universities. BREATHE has administrative and biostatistics cores, as well as an air quality monitoring laboratory. BREATHE consists of a large team of faculty researchers and clinicians, staff from a variety of disciplines, and students from both undergraduate and graduate programs. BREATHE provides facilitation for the UK Markey Cancer Center's Comprehensive Lung Cancer Translational Research Group. BREATHE is directed by Dr. Ellen J. Hahn, PhD, RN, FAAN, with a critical expert guidance provided by the BREATHE Advisory Board and over 80 organizational community partners. BREATHE is a clearinghouse for information, research, analysis, and public policy development, as well as community education and outreach related to smoke and tobacco-free policies, tobacco health disparities, electronic smoking devices, tobacco prevention and treatment, and radon reduction. BREATHE has had success working with both rural and urban communities and in economically diverse localities. The Radon Policy Division, developed in 2006 and funded in part by the Kentucky State Radon Program, houses an evidence-based community outreach and research center to raise awareness about the dangers of radon exposure and prompt action to reduce radon risks using evidence-based practices. Radon research focuses on reducing the synergistic risks of radon and tobacco smoke exposure. The two Major programs within the Radon Policy Division are provider education and geological mapping. The provider education programs offer free continuing education credits for the healthcare and public health professionals, as well as materials to share with patients, providers, and community members. The geological mapping program partners with the Kentucky Geological Survey, also located at the University of Kentucky, to evaluate radon potential using observed radon values and rock formation type, and to create county-specific maps and information, some of which you will be seeing on the screen. The Radon Policy Division's faculty and staff serve on the American Association of Radiation Statistics and Technologists, Foundation Board, and the Kentucky Governor's Radon Advisory Committee. Hardin Stevens, our second guest. Hardin has his Master's of Arts, and he joined Family and Consumer Sciences with the University of Kentucky Cooperative Extension Service in December of 2021. Hardin has an extensive background in program management, in which he has worked with all age groups. He has worked in higher education, state government, and faith-based settings. He is excited to be a part of the Cooperative Extension Services team and looks forward to working with agents and community partners across the Commonwealth. The Family and Consumer Sciences of the University of Kentucky's Cooperative Extension Service has partnered with the Kentucky Department of Public Health's Radon program to raise awareness of radon and its health effects. As part of the Healthy Homes and Communities initiative, agents are encouraged to share radon information with their local communities. Raising awareness about radon includes defining what radon is, how to test for it, and how to mitigate or fix homes, workplaces, and schools regarding radon. So radon, how is it connected to health? Radon exposure is the second leading cause of lung cancer following cigarette smoking. Radon decays into sticky radioactive particles that get trapped in the lungs when inhaled. As they are broken down further, these particles release small bursts of energy that damage lung tissue over time. If you smoke and your home has high levels of radon, the risk of getting lung cancer is especially high. So why should you test your home for radon? Living in a home with a radon level of 4 picocuries per liter is like getting 200 chest x-rays per year. Just imagine all that radiation. Living in a home with a radon level of 20 picocuries per liter is like smoking 2 packs of cigarettes a day. If you are around secondhand smoke and have high levels of radon, you are at risk of developing lung cancer. So who provides radon information testing and mitigation? Many local health departments have radon programs and provide free radon test kits. The Kentucky State Radon Program offers free radon test kits if you are in a county that does not have a radon program. So you can call your local county health department and inquire about that. And in the next 2 segments of this episode, we're going to learn a lot more about radon in Kentucky from both Hardin Stevens and from Stacy Stanifer. And we will be able to learn about testing and how to mitigate radon if we do find it in our homes. I want to thank you all for joining us. Stick with us so that you can get this great information from our very talented specialists from the University of Kentucky Cooperative Extension Service.
Another summer day has come and gone away from Paris or Rome, but I wanna go home. Oh, I miss you, you know. Let me go home. It'll all be alright. I'll be home tonight. I'm coming back home.
Welcome back to Family Lifestyles. In this segment, we'll be learning more about radon and health effects of exposure with Hardin Stevens and Dr. Stacy Stanifer. Thank you both for joining us.
Thank you, Lynn.
Hardin, the first question is for you. What is radon and why is cooperative extension involved or concerned with it?
Thanks, Lynn. Cooperative Extension is committed to improving the quality of individual and family life throughout the Commonwealth and with the relationships that our county agents have with their local communities. It was a natural fit to partner with the Kentucky Department for Public Health to raise awareness about radon and its negative effects on health. And as is well documented, lung cancer is a huge problem in Kentucky. Most lung cancer cases are due to tobacco use, but some of these cases are also due to exposure to radon. The Kentucky Department of Public Health defines radon as a cancer-causing radioactive gas that comes from the natural breakdown of uranium in the soil, rock, and water. Radon gets into the air we breathe through cracks, crevices, and openings in our home's foundation. Radon gas is not visible and it has no odor or taste. And it's the second leading cause of lung cancer in the United States, estimated to cause thousands of deaths annually. Only smoking causes more lung cancer deaths.
Thank you, Hardin. The next question is for Dr. Stanifer. With your research at the UK College of Nursing Breathe program, can you tell us about the health effects and impacts of radon in Kentucky?
Yeah, so as Hardin mentioned, radon is a naturally occurring radioactive gas that is the second leading cause of lung cancer. So as we breathe that gas in, it can deliver tiny doses of radiation to the cells that line the lungs. And over time, damage to those cells can lead to lung cancer. While breathing in radon is dangerous for everyone, it is even more harmful when someone also breathes tobacco smoke. So researchers from all across the globe have determined that those who smoke and are exposed to radon have a 10-fold greater risk of developing lung cancer than never smokers exposed to the same level of radon. So given the radon risk potential, as well as the smoking rates in Kentucky and lack of smoke-free laws in some of our areas, the combined exposure to radon and tobacco smoke is a real concern for our state. And it's estimated that approximately 1,033 radon-induced lung cancer cases are diagnosed annually in Kentucky. So what we're learning from our research is that many people in Kentucky don't talk about radon, and therefore they're unaware of radon and its health effects. We also know that only 13 out of every 10,000 homes in Kentucky have been tested for radon, and there are disparities in testing. The research that we're doing, along with our community partnerships, as well as with partnerships with the Kentucky Geological Survey, the State Radon Program, and the Cooperative Extension, all strive to reduce barriers and make home radon testing and mitigation affordable and accessible to everyone in our state.
It's amazing when you think about the impact and the high prevalence of lung cancer in Kentucky.
That's right.
So part of the reason why we're doing this episode is to reach out to more people to make them aware of this issue that we face in Kentucky. Dr. Stanifer, could you just share with us a little bit about what are some of the symptoms of lung cancer?
Sure. So lung cancer, one of the things that you'll hear really is if you have lungs, you're at risk for lung cancer, or anyone with lungs can get lung cancer. So some of the symptoms that someone may experience can resemble some of the symptoms you might experience with other illnesses or diseases such as COPD, perhaps asthma, but you may recognize a cough that doesn't go away or gets worse over time. There can be even blood in that cough. You could experience some wheezing, some weight loss that is unknown, or if you're losing weight but you're not trying to, and feeling tired all the time could be another sign of lung cancer. Right now, we do have lung cancer screening available for those who are considered to be at high risk, and those are folks generally between the age of 50 to 80 who have a 20-pack year history of smoking, or they've quit smoking within the past 15 years. So those are the general eligibility criteria for lung cancer screening. If someone is a smoker or has smoked in the past and knows that they've tested their home and has high radon levels, I would encourage them to share that information with their doctor as well.
Okay, that's great. Thank you for sharing that. So the next question is, can you also share with us how Kentucky's geology contributes to radon issues?
Yeah, so in Kentucky, we're really fortunate that the Kentucky Geological Survey has the country's most detailed statewide geologic map, meaning that we've been able to, or the Kentucky Geological Survey has been able to map with great detail the different types of bedrock that make up Kentucky. And we know that radon is produced from the radioactive decay of uranium in rocks. We also know that different rocks contain different amounts of uranium. So with that knowledge, in collaboration with the Kentucky Geological Survey, we combined results from approximately 72,000 home radon test kits that were collected over a 28-year period in Kentucky with that statewide geologic map to develop the geologically based indoor radon potential map of Kentucky that you see there on the screen.
Yeah.
So this map is a visual representation of indoor radon potential and can be used to tell the public that based on what we know about homes built on that same type of bedrock, the levels in your untested home could be as high as the value on the map. But the bottom line really is that testing is the only way to find out a home's radon level. So all homes should be tested.
Okay, thank you. And the next question is for Hardin. Is radon found only in Kentucky, or is it present in other parts of the country?
No, radon is found across the country in varying levels. And in looking at this Environmental Protection Agency map of radon zones, those living in zone 1 have the greatest potential for elevated indoor radon levels, while those in zone 3 have the lowest potential. However, no matter where someone lives, the EPA encourages everyone to test their home, know their level, and fix that when needed if their radon level is elevated. According to the EPA, Kentucky is ranked in the top 10 of states with the highest radon potential. So combined with our state smoking levels, this is a bad combination and contributes to the high levels of lung cancer cases in the state.
Okay, and I have one question. Is testing one and done? Like, I tested my home many years ago. Should I test it again?
Yes, it is recommended that you test often, especially if there is changes in maybe you remodeled your home, or maybe you have made a space in the basement into a bedroom, or if you notice changes in your foundation. Maybe there's a new crack, or maybe just some settling. It is recommended that you test at least every 2 years.
Thank you, Hardin. That's really great information. And we will be back with one more segment with our wonderful guests to learn more about testing and mitigation and how to fix it if you do find that your home has radon. Thanks for sticking with us.
Is there a danger hiding in your home? Unused opioid medicines could harm your family. Find your unused opioid pills, patches, or syrups and learn how to dispose of them safely at fda.gov/drug disposal.
And we're back with Hardin Stevens and Dr. Stanifer. In this segment, we'll learn more about testing for radon and how to fix it if you find it in your home or workplace. Our first question is for Dr. Stanifer. Let's talk about radon in Metcalfe County, because that's my home county, and how we can test for it.
Sure. So as you can see from the map of Metcalfe County, the rock types within the county have high radon risk potential, putting many of those at risk for elevated radon inside the home. In addition, only about 8 out of every 100 homes in Metcalfe County have been tested for radon. So we have a lot of room for improvement. Testing for radon is easy and it's inexpensive. There are different methods of testing, including some do-it-yourself short-term, long-term, and continuous monitoring or you can hire a certified radon measurement professional. The DIY kits can typically be found at a home improvement store or by contacting the state radon program. In addition, those in your viewing area who have a Christian, Logan, Rowan, or Pulaski County Library card can go right now to the library and borrow a continuous home radon monitor to test their home.
Oh, that's great.
Yeah, this is part of an ongoing study that is funded by the National Institute of Environmental Health Sciences that aims to increase access to home radon testing by placing these detectors inside county libraries in Kentucky. So when testing for radon, finding the right location in the home is important. When considering where to place the detector, you'll want to think about how the home is occupied and its general layout. So you should choose the lowest level of the home where you or a household member spends at least 8 hours per week. Choose a location that is at least 6 inches from any exterior wall and 5 feet from exterior windows or doors. In addition, keep it away from heat and air conditioning vents and out of any direct sunlight and away from areas of high humidity like kitchens or bathrooms. In addition, place the detector out of reach of children and pets, because once you determine where you're going to test and you place the detector, it should not be moved during the testing period. And then when you get your results, it's really important to recognize that while there's no safe level of radon exposure, if the home test reveals a radon value of 4.0 picocuries per liter or more, the Environmental Protection Agency would recommend that you take action to lower the level inside the home. And if the radon value is between 2 and 4, they would recommend that you consider fixing the home.
Thank you, Dr. Stanifer. That's really great information and very specific. I think that I need to test my home again very soon because I probably didn't do it correctly when I did it many years ago. So Hardin, how does one fix their radon problem if they find that they have it after testing?
Sure, thanks, Lynn. Fixing in a home for radon is called mitigation, and the most common technique used is soil suction, which involves drawing the radon from below the home and venting it through the pipe to the air above the home, where it is quickly diluted in the outdoor air. It is recommended that a qualified radon mitigation contractor be hired to fix a home when there is elevated radon levels in that home. In fact, in Kentucky, there is a regulation in place that requires any person or business conducting radon mitigation must be certified and registered with the state. This is important as radon mitigation requires specific technical knowledge and special skills. Without proper training, you could increase the radon level inside your home or indoor space.
And we definitely don't want that to happen. So it's great that there's a resource that people can go and access and find and mitigators that are licensed. And I actually went and looked at that before our segment, and there are quite a few in our area. So there's more than one to choose from if you live in our general area. So how does someone, what would you recommend? Just going to that list? How would you recommend that people decide who to pick?
Well, I would recommend to find a certified radon professional, going to the National Radon Proficiency Program website, and you can Google that, then you enter your zip code. And then after entering your zip code, the website will pull up a list of professionals in your area. And from there, you can click on the professional's link to find their contact information, business information, and see what other people have said about their work.
Oh, that's great.
I do want to reassure everybody, these professionals have passed a national exam. They are required to receive continuing education classes and must provide proof of proficiency demonstrations. They also follow a quality assurance plan and a strict code of ethics. And there is a national radon proficiency program that serves as the credentialing body for the American Association of Radon Scientists and Technologists. So there are boards and certifications involved, and so there is a set of standards that these professionals do need to meet. And the cost for installing a radon mitigation system, because that's a question people will have, will vary by house and by geographic area, but the approximate costs are the same as a small home project. But just a reminder that even after having a mitigation system installed, it is highly recommended to still have your home tested every 2 years after that. For those who are considering building a new home, it's important to know that it's possible to build a new home using radon resistant features, and incorporating these features at the time of construction is almost always less expensive than fixing an existing home that has a radon problem.
Thank you, Hardin. Speaking of homes, Dr. Stanifer, I know you have some knowledge about the real estate industry regarding radon. Would you share a little bit about that with us, please?
Sure. In December of 2019, a regulation passed in Kentucky, which added a radon awareness disclosure statement to the seller's disclosure of conditions form. So on the previous form, it would ask you, has there been any testing on their home? And owners could mark yes or no. That remains on there. What they did add was a warning statement to bring attention to the buyer and the seller that there may be radon in the home, and radon is a cause of lung cancer. This is a prime opportunity. In addition to what Hardin mentioned about building homes with radon resistant new construction, during the sale of a home is a really good time to draw attention to the potential for radon being in that home. And you can then potentially negotiate the cost of mitigation into the sale of the home. And then the homeowner that's going to be taking occupancy can just have some real comfort in knowing that they're moving into a home that doesn't have a radon problem.
Thank you. That's very informative. And one more question for Hardin.
Sure.
What about public buildings in Kentucky, where people may spend 8 or more hours a day working? Do they have to test for radon?
Currently at this time, no, there is no state regulations that require testing. But as we're doing here, we're trying to raise awareness. So if you have concerns regarding your workplace, a school setting, maybe a faith community setting, I would encourage you to go to your supervisor or the manager of that building and ask and encourage them to look into having your indoor space tested for radon. But currently that is not required by the state.
Great. Thank you so much to Dr. Stacy Stanifer and Hardin Stevens for joining us today and sharing your wealth of knowledge about this very important topic. Take care.
Thank you for having us, Lynn.
Thank you, Lynn.